and I head community engagement for Innopark Ventures. And this webinar is a part of our Matchathon 2020. Over to you to introduce Vaibhav Tewari today.
Thank you, Jo. Thank you so much, Vaibhav, for being with us today. Innopark Ventures warmly welcomes you and the rest of the audience. I think we have members of the audience joining in as we go along. Just to introduce Vaibhav to everybody, I know you've seen posters of him everywhere saying he's the CEO of Portea. Vaibhav is actually one of the in his capacity to up to 4,000 employees. Portea is the largest consumer healthcare brand outside of hospitals in India. Vaibhav has played an instrumental role in what Portea is today. Again, today we leave it, the screen is open to you, as we are saying these days at the webinar, for you to please take us through the journey of Portea and also tell us a little bit about what is it that the healthcare sectors are doing during the pandemic, and what does it look like post-COVID? What kind of support, what are the new evolving things with the healthcare sector? Thank you so much, and over to you.
Great. Thank you, Sita. Thanks for inviting me and giving a great introduction. And good morning, everyone. I thought when we got discussing on what we can present about healthcare, I thought I can quickly take everybody through what Portea is all about, what we do, and in these COVID times, what kind of innovation opportunities have been there, what we have done as an organization. And then, of course, we also will look at how the healthcare landscape is changing and what are the possibilities in the overall context in the ecosystem changing and the healthcare landscape changing. So what is possible? And then any other participants, if they are looking at setting up their own venture or wanting to learn a little bit more about the space, I think it will give them enough understanding of how to go about it. So if I can share my screen. So I just wanted to quickly probably take a couple of minutes and introduce what Portea does. So Portea started around 7 years back, and the whole idea behind the company's concept was that India healthcare market was driven a lot by corporate hospitals. So corporate hospitals have been there for last 20 odd years or so, and have reached out to many of the tier 1, tier 2, tier 3 cities. So we realized that there's a willingness to pay, and there is a basically ability to consume, or willingness to consume high quality healthcare services was being built in the Indian market, and consumer was ready to basically consume healthcare which is of high quality and at the right price. What we saw was an open opportunity. We were saying outside the hospital healthcare market was still very, very nascent. So what happens before you get into the hospital, what happens after discharge, I think those parts were still not very, very well covered in a professional manner. And the whole idea behind Portea's genesis was that saying, can we get into this space and create a robust outside the hospital healthcare company, which can support patients with high quality healthcare, hospital-like healthcare at the right prices. So that was the idea behind starting Portea. And we looked at basically 4 key verticals which we are looking at building, which is around primary care, chronic disease management, elder care, and post-operative care. So if somebody gets admitted into a hospital for a surgery or a procedure, and once he gets discharged, that is post-operative care. Of course, primary care is about visiting your general physician for infection management and so on and so forth. Physiotherapy, chronic disease management includes all the disease like diabetes, hypertension, and sleep problems, which probably will be with you for lifetime, and you have to learn how to manage that and live with it happy and healthy. And of course, elderly care, which India has, though is being called or hailed as a country with a lot of young people, India also has close to 12 crore people who are 60 plus, and taking care of them is also equally critical. So the 4 care segments which Portea has been operating in. And of course, there are multiple services which we offer as part of that. That is physiotherapy, nursing attendant, nurses, doctor visits, diagnostic services, mother and baby care for new mothers, and as well as the equipment. So other thing which we do, medical equipment is a key part of what we offer. So the whole idea behind this is that once we enter into a relationship with the patient, can we manage their complete healthcare requirements at home or on their offices, apart from hospital, of course, because for tertiary care you have to go to the hospital. For everything else, our idea is that we come to your home or a place of choice and support you with all the healthcare needs. And the whole model is built around extensive patient engagement. So once we enter into a relationship, we try to make it a lifetime relationship with both with the patient as well as with the family. The whole model is built around a very, very robust technology platform, because without that, the kind of scale which we are trying to build and have achieved in the last 7 years would not be possible. So we have our own homegrown ERP system. We have a very, very detailed patient engagement, patient management platform. And using that, basically, we engage with all our clinicians who go to the patient homes. Of course, also engage with all our patients and their family members on an ongoing basis. Very, very robust medical team, because that's another core of this business to be built. And what we have done in the last 7 years is that we have been able to build a fairly sizable outside the hospital healthcare company. We basically serve close to almost 25,000 patients in a month, and we acquire almost 12 to 15,000 new patients in a month, and do close to 150,000 patient visits in a month to patient homes. We have around 4,000 people across the country, present in 22 cities, and continuously growing in adding newer and newer verticals basis what our patients require and what they ask for. And of course, how the market has been playing, and how we can continue to support patients for all their medical needs in their place of choice, that is either home or the corporate. So this is a little bit about our journey. We started in 2013, the first organized large healthcare, home healthcare services provider. Of course, started with physiotherapy and nursing services, and continue to build. A couple of years down the road, we acquired a couple of companies to support us in other services, which is medical equipment, as well as the specialty pharma. And then, of course, from there, we have continuously added services in the last 7 years and have continuously grown. We signed up almost all the large hospitals we work with as their home healthcare provider. Manipal, Columbia Asia, Medanta, Narayana Health, you name any of those large fortes, all the large hospitals where we've been present and working with them to build a large home healthcare services play for them. Of course, continuously added services. You see the things like ICU at home. That's something which we launched a year and a half back or so. And the whole idea is that patient, after he's in the hospital and is basically getting treated in the ICU, post-ICU discharge can be either for end-of-life care or for recovery, where they don't need to be in the hospital ICU, because after procedure is more of like stay and being under observation. The whole idea is, can we manage the whole critical ICU setup at home for the patient and support them? That's something which we launched. And at this stage, when we speak, we are managing anywhere between 150 to 170 ICUs at home right now across the country, where the complete setup, including ventilators, monitors, doctor availability, 24/7 nurse, the complete monitoring, all of those things are provided like a hospital level ICU care at probably 1/3 of the cost. And it is done in basically consultation in continuation of the treatment being offered at the hospital, done along with the hospital treating doctor, to make sure the patient gets the same level of care at home also. So the complexity of what is possible to be done at home is something which a service like this shows. Of course, we provide oncology care at home. We do even chemotherapy at home. We do rest of the PICC line care, port flush management, all of the things which are done either in a daycare in the hospital or in even things like ICU, we are being able to manage at home, and have served close to 1 million patients so far, have won a lot of awards for what we have been able to do. Because in general, this concept, having patients and clinicians both not within the premises, I think all the healthcare before that, one of the two is in the premises. We are probably the first large organized player where both of them, whether patient or the clinicians, both are not with us, not in our premises. And we were able to create a large scale operations and a large scale business to run that very, very effectively. And that's all these awards show for that. So I've taken this slide basically till 2019 journey, because 2020, everything changed for everyone in once the COVID advent happened in late 2019, early 2020.